Grant, first kind of walk me through what your thoughts are on our current situation in general as far as unemployment goes.
Well, you can get a pretty good sense of where unemployment is going to be going if you just look at initial claims for unemployment insurance. And so if you look at both the US and what's been published for the state, we've seen a massive surge of unemployment claims in the last couple of weeks, in particular last week. And so that's usually a leading indicator out over, let's say, the next 3 to 5 months of what's going to happen to the unemployment rate. And so the expectation now is the unemployment rate is going to spike very quickly.
Okay. And I know we'll get more deep into that here moving forward. So as you mentioned, record unemployment claims actually filed last week in Washington and across the nation. So with more expected this week, has the nation already entered, would you say, into a recession as the coronavirus unfolds?
Yeah, we're there. I mean, at this point, it seems kind of implausible to me that we're not in a recession.
Can I elaborate on that? Why you think we're there?
Well, I think if you just look at the scope of the initial claims for unemployment insurance, if you look at the number of furloughs, it's going to be pretty hard to sustain or impossible to sustain the spending that's required to keep the economy out of a recession. And so the only issue is how deep is the recession going to be? You know, what's the loss in terms of GDP growth? And how long does it last? What would be the duration of the recession? So depth and duration are two unknowns right now.
So has there been another time, kind of speaking to the recession, has there been another time in the U.S. history that the economy has been so widely interrupted?
Yeah, there's been a couple of cases. You know, the most obvious case is the Great Depression, which was a massive disruption. But the reasons for it are quite different than what we have now. But at the height of the Great Depression in the United States, the unemployment rate was about 25%. That was the official unemployment rate. Many people think that that's entirely plausible for an unemployment rate as a result of the COVID shutdown. And so, you know, so in other words, pretty high double-digit inflation is expected at this point.
And just for comparison purposes, so the Great Depression, mentioned reasons are different, kind of compare and contrast to those reasons, yeah.
But the severity of the downturn, I mean, this is going to be a pretty severe downturn. And so again, the expectation is we're going to see pretty high double-digit unemployment, maybe not unlike what we saw in the Great Depression in terms of the level.
Can you speak to Spokane's history? Have we seen anything like this relating to employment?
It's extremely rare for us to escape a recession in the region. So in the inland Northwest, if the U.S. goes into a recession, we go into a recession. The only time we really avoided a recession was the 1990-91 recession. If you look historically, we've had to go into recession just like the rest of the U.S. And if you look at the Great Recession, which we had in 2008, 2009, the unemployment rate here was around 11%, a little bit higher than the US, which was around 10% at the peak. And again, my guess is the unemployment rate will be higher than that this time.
And why was that? So you're saying Spokane was at about 11% and the nation was at 10. I mean, only a percentage off, but why was there that difference?
Well, it could be a little bit of structural, how our regional economy is structured in an employment sense versus the U.S. If you go back to 2008, 2009, it just seemed like because of the nature of our regional structure of employment, we got hit a little bit harder than the U.S. did during that time period. So we had, relatively speaking, larger job losses, which meant our unemployment rate was going to be a little bit higher, which it was.
Yeah, definitely. So I guess kind of touched on this, but more concisely, how would you compare our current economic situation to the Great Depression?
Well, I think to some extent, I'm a little more hopeful, in part because compared to the 1930s, the federal government in the form of the Federal Reserve and Congress through fiscal policy has moved very rapidly, and that's going to help mitigate things. In the 1930s, the federal authorities were very slow to move on what was occurring, and that did worsen the situation. We've learned our lesson since then, and so if you look back to even the Great Recession in 2008, 2009, and what's happening now, the federal authorities have moved very quickly to try to arrest some of the worst effects of this sudden downturn. So I'm actually
kind of lesson learned there, yeah.
Yeah, I mean, the 1930s taught us a lot of lessons, and one of the lessons was that you need safety nets. If you don't have safety nets for people who suddenly lose their job, consumption collapses, and it just makes everything much worse because you get into a downward spiral. And so we learned that lesson, and so now you tend to see very rapid action by the Federal Reserve, by fiscal policy, if it's possible, to try to act as a safety net, in addition to unemployment insurance and these other things that were put into place as a result of the Great Depression in the 1930s.
Is it fair to ask if our nation acted fast enough, even though they moved quickly? Was it fast enough?
Well, that's a good question. And I think to some extent it depends on the actual rate of infection in the United States and the rate at which that infection is changing over time. And we don't actually have good data on that right now. We still don't, I think, have a great handle on that. And as a result, it makes it very difficult to understand whether or not we acted soon enough, and also to what extent, how deep the recession is going to be and what the duration of it is going to be.
So do you have any estimates on how high we might see the unemployment rate spike in Washington?
They're all over the place right now. I've seen some estimates. Most of them have been for the U.S. And so, you're seeing estimates for the U.S. in the neighborhood of, the mid-20s to 30% unemployment rate. Now, you have to be a little bit careful with the interpretation of that, because as a result of the new fiscal stimulus policies, they've sort of widened the eligibility for unemployment. Okay? And so you're comparing a little bit of apples to oranges looking at the past, because the rules for getting unemployment insurance are perhaps a little bit different now.
Right. Yeah. Keeping that in mind for that spike.
That's right. But it'll be, I think it'll be a fairly, it'll be an eye-opening number, and it'll be, I think, noticeably higher than what we saw in 2008, 2009 time period.
Ballpark number, if you were to put a number?
I haven't got enough data yet to come up with a good ballpark number, but at the rate at which I'm seeing initial claims accumulate, above 11% easily.
And that's, and you mentioned 11% was where we were at
in the last major recession in 2009, roughly.
In 2009. So so we could see it look the same, essentially, about the same as the last recession of 2009.
At least, my guess is it'll be noticeably higher.
Or higher than the 11%? Or?
Yes. Yeah, I think it highly likely that it'll exceed the peak that we saw in 2009.
Oh, sorry, my computer's saying, thinking, do you mind repeating that?
Yeah, so I think so based on the way we're seeing initial claims for unemployment insurance accumulate, it's highly likely that the peak unemployment rate in this recession will be noticeably higher than the 11% peak we saw in the region in the last recession.
Great. I guess, can you speak to Idaho? Same response. Where do you think we'll get in Idaho?
Yeah, and actually, when I think of the region, because really Spokane and Coeur d'Alene were integrated economies, really, they're going to experience the same thing.
Even the state as a whole, Idaho, not just.
Yeah, I mean, no state can really escape this.
Let me try and mute my email coming in. Sorry, I didn't think about that.
It's all right.
So let's see. And as far as the nation, so we've looked at, kind of looking at Washington, Idaho, they'll experience about the same spike, but as the nation as a whole, where do you see that going?
Same thing. I mean, my guess is if you look across the states in the U.S., they're all going to experience, I think, a very similar spike in the unemployment rate. we're all kind of going to be in the same boat here for the most part.
So how do you feel the greater Spokane area is poised to weather the economic fallout from the coronavirus?
Well, the good news is that, the last 4 years in the region have been pretty good. We've had considerably higher growth than the rest of the U.S. in the region for the last 4 years. Going into this, we looked pretty good in terms of the economy. And so from a starting point, we're going in from a pretty strong economy, which is useful compared to going in with an already weak economy. Growth had been slowing for a little while, but still relative to the U.S., we looked pretty good before this hit.
Do you have any idea of what factors played into that growth or what made us strong?
Yeah, one of the things, this expansion before it ended has really been, it's a 10-year-long expansion before it ended, has really been heavily weighted towards the West. And I think just part of it reflects our position relative to Asia. That's generated a lot of growth. But we've also seen just a lot of in-migration to the West, including our region and the Pacific Northwest. And that in-migration has also helped generate a lot of economic growth.
So kind of that increase in population to our area has kind of bolstered that.
Right. Yeah, I mean, what happened is when the recession in 2008, 2009 finally ended, a lot of the major cities in the West recovered pretty quickly because they had high tech, they had aerospace, and so you had pretty good job creation here early on. That began to draw people into the West as they looked for places to find new employment. And it really hasn't stopped. We've had really pretty incredible population growth really for the last decade. And that population growth in itself begins to generate some new economic activity. And so that definitely benefited us in terms of keeping us growing pretty well up until this hit.
Is it that same factor that will allow us to stay strong moving forward or puts us in a good position?
Again, it really kind of depends on how quickly our regional industries can recover. And to know that, you have to know a lot more about what is the true rate of infection and the rate of spread. And again, that remains a little bit of an unknown for kind of coming up with a recovery period.
Let's see. I know we spoke more about moving on. So what kind of impact do you think the $2 trillion economic stimulus package will have in our region specifically?
Well, to some extent, it depends on how quickly it gets delivered. But, the biggest thing is that it just simply helps prop up consumption, right? Again, going back to the problems we had in the Great Depression in the 1930s, what this does is gives a little bit more breathing room to households, in addition to the normal safety nets like the unemployment insurance, to keep their consumption from completely collapsing. And in particular, it means they can continue to, hopefully pay their bills, pay those crucial bills that, people need to continue to pay, like food, rent, these kinds of things.
So go ahead.
It just basically keeps us from falling too deep in terms of a collapse in spending. But again, some of that's going to depend on how quickly they can start delivering that aid. And I think the plan is to make it as quick as possible.
So is it a two-way street, receiving that funding, but also folks making those purchases, stimulating the economy?
Yeah, my guess is if you look at in the past where if you look at where people have received some kind of benefit, like there was a tax cut during George Bush's administration, the second George Bush, and there was I think it was like $300 per taxpayer or something like that. But it turned out that a lot of people spent that money. My guess is a lot of the direct injection that households are going to get from this federal stimulus, for most households, they will spend most of it.
How do you think the stimulus package will have an impact on the nation? Same kind of thing or different?
Same thing. They're just trying to keep consumption from collapsing.
So we've been kind of keeping an eye on the NYU professor and White House economist, Nouriel Roubini, I believe that's on it, right?
Rubin, yep.
Nouriel Roubini, New York.
Mhm.
Oh, my phone's glitching here. All right, so Nouriel Roubini, a NYU professor and a White House economist for the Clinton administration, he said he expects the crisis to be worse than the Great Depression, and pointing out it took 3 years for the economy to crash then, whereas the coronavirus has crashed our economy in a matter of 3 weeks or so. So do you agree with his position?
I mean, I think at this point, you're hearing a pretty broad range. So he's not the only economist in the U.S. talking about this. And if you listen to different economists, you get actually very different views about how the recovery is going to go. I mean, most people think it's going to be a fairly deep recession, but there's a wide opinion on the duration of how long the recession is going to last and how long it takes to recover. Again, until we get a better handle on the science of COVID-19 in terms of what is the true infection rate, what is the rate of spread, it's kind of a guessing game in terms of how the recession is going to materialize and how long it lasts.
So do you agree with him?
I think it's one possibility. It's not the only possibility.
Great. Are there any indicators that give you hope right now moving forward?
Well, oddly enough, there's one thing that actually gave me a lot of hope was how quickly Congress actually moved. These are pretty partisan times, but I wouldn't have guessed Congress under its current partisan state would be able to respond as quickly as they did. And that actually gives me some hope that everybody there is more or less, let's say, on the same page about how severe this could be. And that really gave me some hope that they're taking this seriously.
And I know for viewers that are going to hear this segment today, we're hearing numbers. We're hearing it may be worse than the 2009 depression, comparing Great Depression. Can you give some insight? I mean, should we be worried?
Well, I think anytime a recession hits, households have to take a step back and decide, how do we weather this, right? So in that sense, yeah, you should take it seriously, because you want to make sure that as a household, you're looking at the situation and you're adjusting your behavior so you can survive as well as you can. But it's important to remind everybody that this is not the 1930s. I mean, it's a little bit different environment. We've actually learned some lessons since that time period. We've seen very rapid action by the Federal Reserve, by Congress and the president. And I think this reflects, the learning we've done since the 1930s. I'm actually fairly optimistic that even if this is a deep recession, we will recover from it and we'll return to some growth path. But again, until we have a better idea about actual infection rate and rate of spread, it's again very difficult to really say with any kind of definity what the recession is going to look like. But yeah, you should take it seriously, and households should be saying, how do we respond to this in case it's fairly long?
Be prepared and taking it.
Right, exactly.
Is there anything else that you'd like to add, kind of where we're at, if anything I didn't ask you that you might want to mention? Or?
Well, I think it's also important as we look at this is to look at how other countries are responding to this. I mean, I'm a big believer in looking at, other experiments and how other countries are dealing with this, and looking at both their failures and successes and saying, how do we need to tweak our response, again, to try to minimize the length of time we're in this situation.
Do you have any countries that come to mind that are a good example for us?
Well, I think right now some people have talked about Germany having had a relatively what appears to be a pretty good response to it. I also think we ought to be looking at other countries in terms of how well their public health system has responded to this crisis relative to our own. I think maybe it's time to have a debate about how we modernize our public health system. Because, you know, one of the things that really helped the US become an advanced country was that, you know, we developed a public health system. We realized that we need public health to keep the public broadly healthy because that's good for economic growth. Maybe now what we need to do is review what our public health system looks like, how we fund it, and look at what other countries are doing that have worked well in this crisis and say, how do we need to change ours?
So I wonder if, you mentioned kind of we had some lessons learned from the 1930s, from 2009. What do you think it's going to be, what do you think are the lessons going to be learned from this situation?
Well, I think one of the lessons we're going to have to learn is that when countries begin to experience this, other countries begin to experience some kind of viral infection or bacterial infection of this scale, that we can no longer ignore it on the assumption that it can be isolated. Right? And because of that, that means we have to, again, rethink in particular how our public health system is organized, right? And how the World Health Organization, the WHO, is organized so that everybody can start talking to each other about, you know, how they need to respond, given the fact that these cases are no longer likely to remain isolated. And I think that's really going to be one of the big lessons learned here, is that we have to start talking to each other, even countries we maybe don't like very much, on a public health level, to keep these things from spreading so rapidly so we don't end up in this situation again.
Would you say kind of how we responded this time around, it was maybe an afterthought, and that's why it's a lesson learned here?
Yeah, that was my concern is that we maybe waited too long, and you know, and not just us, other countries as well. And so again, I think the lesson here is that we need kind of not only to rethink about public health in the United States, but we also need to rethink about how we're communicating with other countries about health, so that we're talking about what's happening inside our countries with the understanding that they're not likely to remain isolated anymore. When we have these kinds of viral infections or bacterial infections, something of this sort. I mean, in some way, we need to be able to talk to each other about these things like we talk to each other about not going to war with each other. I mean, we need to have that kind of level of communication going on.